Joellen Gregory, Otterhound breeder, expert, and owner, and totally the OtterTalk helpful person. Thank you.
Veterinarian. You may want to add that for those.
I think I said that. Didn't I say that? Veterinarian? Did I say that? Hey, veterinarian. Dr. Joellen Gregory, veterinarian breeder and Otterhound owner. Thank you for being here. I'm going to turn it over to you. So if you want to tell us a little bit about yourself and then start your presentation, and then I'll be gathering questions as we go.
Sure. So hi, everybody. Nice to see you. I have been interested in Otterhounds since 1991. I actually have an undergraduate degree in political science, which you're not going to find from most veterinarians. But my first Otterhound, Tony, took me to veterinary school. So he came home in 1997. I ended up having to do all of my prerequisites for vet school. I started vet school in 2001, graduated in 2005. So I have been in Otterhounds longer than I have been a veterinarian, but I'm always happy to share whatever information I can with people that are interested. So we got a list of things that people wanted to talk about today. And so I just made a quick little PowerPoint to be able to go over everything and not forget things. So if anybody has trouble seeing or has questions as we're going along, as I said, we will I'll stop between things and we can talk about it if you have questions at that point. So I was asked to talk about health issues big and small that pertain particularly to Otterhounds, and my first response to Robin was, well, it'll be a quick talk because there's not a whole lot that's really specific for Otterhounds. Otterhounds, there's really nothing that I would say is Otterhound specific, but we do go over a lot of the things that people ask about. So we'll start. We're going to start with our puppies. So the first thing that I usually will get asked is, what do you feed? And if you just bring your puppy home, my first statement is to discuss it with your breeder. They may have some experiences with dogs in their lines that do not reflect typical for most dogs. So what I'm saying here may not be appropriate for your puppy's lines, but if you have a discussion with your breeder or if they say everything else is normal, then I would follow these recommendations. So I recommend feeding either an all life stages food, a large breed puppy food, or a food that's labeled similar to what you see on your screen. And so this is actually copied and pasted from the ProPlan Performance Sport, and it says animal feeding tests using AFCO procedures substantiate that the ProPlan Performance 30/20 provides complete and balanced nutrition for all life stages, including growth of large-sized dogs. And so you want to make sure that you have that growth of large-sized dogs. Other AFCO labels that you may find on your food, if you're not feeding Purina, Royal Canin, Iams, Eukanuba, or Hills, it's going to say that it is formulated to meet AFCO standards. And what that means is that they have done no food trial testing. You have no idea, actually, if they've done any research on the food at all. Most of the boutique companies, the ones that aren't one of those 5 I mentioned, don't even have veterinary nutritionists on staff. So it's important to have something that is food trial tested, because otherwise we're doing the testing on our own dogs. And I don't know about you, but that doesn't make me very comfortable. So the important considerations when you're looking at food is for a large breed growing puppy, it's actually the calcium phosphorus ratio that's most important. And ideally it's a 1 to 0.9 ratio. And you don't want to go over 1.5% max calcium. Min calcium, don't worry about it. They always have enough calcium, but you don't want to go over 1.5% max. So interestingly, the Sport that I was just showing you the label from has changed in the last couple of weeks. The order that I got 2 or 3 weeks ago was a different bag than the order I just received. And the new bag has more calories per cup, which is something that you need to know if you're feeding to make sure that your dogs don't get overweight. It has a different calcium phosphorus ratio. It used to be 0.9% calcium to 0.7% phosphorus, which works out to be close to that 1 to 0.9. And now it's 1.1% calcium to 0.9% phosphorus. So it's close to that ratio still. But you know, it's interesting. They don't have to say anything on the bag. None of the dog food manufacturers are, there's no kind of regulations that say that they have to say something when they change their food. So it's something to make sure that you read every bag that comes into your house. If you're feeding a large breed puppy food, I would do that until the puppy's growth plates have closed, which is usually around 16 to 18 months of age for a large breed dog. We'll keep going with puppies and then we'll come back to questions about puppies. Exercise is something else that I've had lots of questions on. And the most important thing with exercise for large breed dogs is that you don't want repetitive motion on their joints until their growth plates are closed. So that means no running, no jogging, no biking until they're 18 months old. They should certainly be allowed to go on walks and they should sniff here and mosey there, as most Otterhound puppies will, but you don't want any kind of a regimented military style walking where there's going to be repetitive motion on those joints, even walking. And then people always ask, how far can they go? Well, they can go as far as you can build them up to go, keeping in mind that increasing physical activity does not tire out an Otterhound puppy. That all comes with mental stimulation. But you can build them as far up as you want to go, as long as it's random movements. They're going over here, they're coming over there, and they're sniffing and moving around without any kind of military style action. I can also tell you, I have had in my line some elbow issues, and I'm 99% sure it's because of the obedience training and the agility training that I do while their growth plates are still closed, or still open, sorry. I try not to do it. It's just really hard not to. But it's amazing. The dogs that don't grow up in my house will have normal elbows, but the dogs that do grow up in my house don't. So that tells me something there, that there's definitely an environmental factor. Okay, so that's all the stuff that I have on puppies. The only other thing that I didn't write down that I do want to talk about real quick before we go to questions on puppies is, how do you know you're feeding them the right amount of food? And so I tell for everybody, for puppies, for adult dogs, for all breeds except for sight hounds and German shepherds, the trick is actually on your hand. So hopefully everybody can see this. So when you feel down the ribs of your dog, you want to feel their ribs the same way you feel your knuckles with a flat hand. So everybody can see here, I'm feeling across my knuckles. That's exactly how you want to feel your puppy's ribs or your adult dog's ribs. If they feel like this, they're too fat. And if they feel like this, they're too skinny. So I will feel my dogs before I feed them every day. And I make a decision while I'm feeding, who's feeling a little chunky, who's feeling a little thin, who did what kind of activity today, who got what extra treats today. And I make decisions on how much food to give them based on all of those factors. I think one of the biggest mistakes we make as owners is just saying they get 2 cups of food twice a day. And that may not be appropriate. Some days they may need 2.5 cups. Some days they may need 1.5 cups. So it is something that I recommend doing. Okay. Any questions on puppy feeding or exercise?
I haven't gotten any from the chat on puppies.
Okay, we will move on then. And feel free to ask questions later if you think of it. It doesn't mean you're done with questions. So another question that we got was, what orthopedic issues are Otterhounds prone to? And surprisingly, their orthopedic issues are surprisingly uncommon in Otterhounds. And I wrote, no matter what the x-rays look like, because we do have hip dysplasia. The average Otterhound is mildly dysplastic on the x-rays when you look at their hips. And that means that the ball and the socket aren't formed perfectly. And so you can end up with some arthritis around them. And in most breeds, labs and such, that will end up with dogs that are painful when they get older. They have trouble walking. It's just, they really do have issues with getting around. For some reason, I'm not sure why, the Otterhounds just don't seem to have those issues. I have seen some very, very ugly Otterhound hips, and they have continued to move normally throughout the scope of their lives, 12 to 14 years. So it's a good news for us. As a breeder, it makes it harder because, you know, our average Otterhound is mild. So in many breeds, they say if your dog doesn't pass hips, you shouldn't breed them. But I definitely would not agree with that in Otterhounds. But you do want to improve. So you want to make sure that whatever you're trying to breed to is better. Orthopedic issues, I have seen a couple of Otterhounds with luxating patellas, which is a floating kneecap. So the kneecap floats in and out of joint. I have not seen any that needed to be surgically corrected, but in some cases with other breeds, a luxating patella may need surgery to be fixed. I have not seen an Otterhound with a cruciate ligament tear, which is one of the most common injuries in orthopedic injuries in large breed dogs. However, for all large breeds, it's recommended to wait to spay or neuter until their growth plates have closed because we want to ensure proper development of the joint. The growth plates will stay open longer if they are spayed or neutered before their growth plates close. And so that means that the dog is going to be sometimes minusculely, but still taller than they were meant to be. And it throws off the angles that the joint is meant to be at. So we do recommend waiting to spay or neuter until they're older. That's all I have on orthopedic issues. Any questions on that?
No questions on that.
Okay. I had another question about thyroid. And so thyroid's an interesting thing. It's not common to have thyroid disease in young dogs. It's more common in older dogs. I would not say that Otterhounds are more prone to thyroid disease than anybody else. But you do need to know if you're breeding in a line where there is thyroid disease present. I recommend that you test your TGAA, which is thyroglobulin autoantibodies, and that would be the more genetic cause of low thyroid. So high levels of the autoantibodies indicate that the immune system is overactive, and that's not what we want. So to test for that, you would actually have to test yearly for it to be considered a current test. But I think that if you're breeding a dog between 3 and 5, if you test them at that point and they are low, then it's not really going to be that much of a concern. Signs of thyroid disease are low thyroid, which is what dogs get, are weight gain, lethargy, hair loss, particularly bilateral on the flank, and then cold intolerance. That was one of the first signs of my first Otterhound, that his thyroid was low. And we were living in Minnesota, God help us. And he would be standing outside in the cold, and he would lift up a foot, and I'd say, oh, he's lame on the right front. And I'd look back out there, and his left front was lifted up. I'm like, wait, now he's lame on the left front. And it would go back and forth between all 4 feet. And what it was is that he just was very sensitive to the cold, the snow, and the ice. So once we got his thyroid under control, that improved things. Any questions on thyroid?
No questions on that.
Okay. Skin. So many Otterhounds and all dogs have skin issues. It's one of the most common things that I see patients for in my practice. And I can tell you, I hate skin. Skin is one of my least favorite things to deal with, I think, because it's the same thing all the time. And it's hard to come up with the right answer. So the most common reason that Otterhounds or any dog are going to have scabs or be itchy, have itchy skin, is from allergies. We definitely have allergies in the breed. There's no doubt about it. But it's in all breeds. It's not just in Otterhounds. So the 2 types of allergies that you'll see are allergies to the environment, which are going to be grasses, pollens, dusts, people dander, cat dander, all kinds of things that are in the environment. And then food allergies are separate. And food allergies are much harder because there's no testing for them. You can do testing for environmental allergies. I don't usually recommend it for my patients unless we're going to start trying them on a allergy vaccine, because what's the point if we're not vaccinating? And so the good news is that we have had in the last 5 years or so a couple of really good medications come out that are great for allergies, as long as they're environmental. So for environmental allergies, Apoquel and Cytopoint are my two favorite ones right now. They're very similar. They're made by the same people. The differences are that Apoquel is a pill that you give once a day, twice a day in the beginning, and then once a day. And Cytopoint is an injection that you get. It generally lasts, it's labeled to last 4 to 8 weeks. I have seen it last from 3 to 16 weeks. So one injection and they don't itch. The benefit to the Cytopoint over the Apoquel is where it affects the immune system. The Cytopoint is at a much lower level, and so there's really no side effects to Cytopoint. Apoquel stops the itch at a higher level, and so you can have other immune issues develop from using Apoquel long term. So if your dog is on Apoquel, you want to make sure that you're having testing done regularly, every 6 months. And I would see if your dog can transfer to Cytopoint. You can use them together if needed. And you can use the Apoquel on top of the Cytopoint if you need to now and then, but not using Apoquel on a daily basis long term is better for your dog's immune system. For food allergies, you have to do an exclusion trial. So what I usually will end up doing is I put them on a prescription diet that has been formulated to have very little reactivity to the proteins. Dogs are usually going to be allergic to either the protein or the carbohydrate in their food. So this particular food is formulated so dogs don't react to it. So we put them on that. It takes 8 to 12 weeks on that with no other foods going past their lips to see if it makes a difference. If it does, then that tells us it is a food allergy. And then we can start adding things back in to try to see what it is that the dog responds to. So if they are doing great on my prescription diet and we start adding back in chicken treats and they start licking their feet or getting ear infections, then we know that it's chicken. Oftentimes it's not going to be the first thing that you try. They can stay on the prescription diets forever, but because of the cost, I usually try to find a diet that they can eat that is not going to be so costly long term. So the other way allergies will show up is as licking their feet or their legs or their rear end and ear infections. We all know about ears. So the ears, we want to make sure we're cleaning them regularly and often. Plucking hair may actually not be as beneficial as we used to think. I had some very hairy dogs along the way, and when I plucked them, they got worse. So I stopped plucking, and I haven't had nearly as many issues without plucking. The purple stuff is great. It's on the Otterhound.org website under grooming. If anybody doesn't know about it, I'm happy to talk to you about it. It is basically boric acid, alcohol, and gentian violet. Gentian violet is an old-fashioned antiseptic, antifungal. Boric acid helps stop the burn of the alcohol. So you want to make sure you're doing this outside because gentian violet will stain. And so the right way to clean an ear is you pour a small amount. People can watch my screen, my video. I pour that much into the ear canal of an Otterhound. You're going to hold on to the ear still because you don't want them to shake their head, and you're going to rub at the base of their ear, which is down by their skull. You want it to squish around. And then I will let go. They're going to shake their head, and then I'll do the other ear. Before I do the other ear, I make sure that I shake the bottle, because when you mix up this concoction, you'll see that the boric acid settles at the bottom. And you need to make sure the boric acid is in solution when you're putting it in. Otherwise, it's really going to sting. And so I shake it up, and then I'll do the same thing in the other ear. And then I hold, I rub, they shake their head, and then I'll wipe just at the top of the ear canal for as far as my fingers can go. Never stick anything down into the ear. I use either a Kleenex or a paper towel, or if I'm doing this when they're in the bath and I don't have anything else handy, I'll grab a towel, just a regular towel. So you can do anything to try to get the gunk at the top out. If you see anything coming out, you need to do their ear cleaning more often. You shouldn't see anything coming out but purple. So brown gunk is the most common, and that's usually yeast. And so I would clean once a day until you don't see anything more coming out. And then 1 to 2 times a week if your dog is prone to having ear infections. If your dog is not prone to doing it, then I usually will do it right after I bathe, because getting water into the ear canal is another common reason for them to develop yeast infection. It doesn't have to do with allergies, but it's just water down in the ear. It's a warm, moist place. It's a great pH. It's a great place to grow things. And so the purple stuff will help kill anything that's in there, and the alcohol will dry out whatever water had gotten in. Okay.
I'm going to stop you on ears.
Okay.
Tom wants to know if powders are good to keep the ears dry, ear powder.
It really depends on how hairy your dog's ears are. If you don't have super hairy eared dogs, then the powder will probably get down into the canal. And when I used to pluck, I would put the powder down first because it kind of numbed it and it gave you something to grab. Now that I don't pluck, I haven't used ear powder on anybody. I think you're better off using the flush because you're getting all the way down in the ear canal. The dog's ear canal goes down and then in before it gets to the eardrum. And so you really need to make sure you're filling all of it with fluid when you're cleaning ears. So putting a little bit of powder at the top isn't really going to take care of that horizontal canal.
I have one more question from Tom. Let me just get it out of the chat here. He just asked, I've also used cleaner from the vet. Is this okay?
I hate to say no, because hopefully your vet does have a good quality cleaner. And what I have found with the cleaners that we provide at my clinic is that they work okay, but they don't work as well as the purple stuff. So yes, you can use your cleaner from the vet. Depending on what the cleaner is, it may or may not have something in it to treat yeast. Most cleaners will just, if it's just a cleaner, it will just change the pH in the ear so that it's not as good of a place to grow things, but it doesn't actually treat anything. So the purple stuff does treat yeast and bacterial infections. There are cleaners out there, like if I have somebody who doesn't want to make the purple stuff, I'll send home a cleaner called Trizultra with keto. It's the ketoconazole in it that treats the yeast. So, and they use it as a regular cleaner just in the same way that I described.
One more question from Tom. It's back a few slides. He wants to know if thyroid issues are more common in bitches or dogs.
I don't know that I have enough experience with thyroid disease in Otterhounds to say that. My gut is that it would be more common in males than females in the Otterhounds that I know, but I don't have enough experience to answer that completely.
Okay. Oh, I'm sorry. Go ahead.
Oh, sorry. Joey, we actually had a question from Joellen Render while we're on the topic of ears and skin. She says, what can be done to treat and prevent bouts of pyoderma?
So treating the underlying condition is what you need to do to treat the pyoderma. And the underlying condition most of the time is going to be allergies, but it could also be something like swimming in pool water and not rinsing them afterwards, or swimming in a pond and not rinsing them afterwards. So I think trying to keep your dog's coat as clean of other things, whether it's chloride or it's pond scum, that will also help prevent pyoderma. Pyoderma for everybody is a skin infection, and that's the scabs that we were talking about.
Excellent. Thank you.
Yep. Anything else from anybody yet?
We had a question that was back a slide also from Joanne. I don't know if you want to save those to the end. So if it's after, if it's after, okay, so this one is on exercise. What about voluntarily sprinting about around the sofa as far as exercise?
So,
is that going to be dangerous if they're volunteering to do that? I know with our puppies, sometimes it's hard to get them not to do that kind of stuff.
Yeah.
Whether you want them or not.
I will usually let them do that once or twice, but I don't let them go on for half an hour doing it. So you really just have to pay attention. And again, if they're sprinting around the sofa, it's unlikely to be the same compression on the joint each time that they're going around, because they're making different loops most of the time. If you're watching them, it's not exactly in the same circle each and every time. But I still would be cautious about letting them do anything that's repetitive. But they're dogs. You got to let them have a little bit of fun.
Yep, especially puppies.
Yep.
Tom says zoomies. We all know zoomies.
Yes, we do.
Okay, go ahead.
Okay. So the next thing on my list was bloat. And so a lot of people may not know what it is. So I just threw in a little bit of information here. So basically the stomach will fill up with air, fluid, or food, and then it twists on itself and it blocks the exit of whatever is in there. It will quickly compress the stomach, and oftentimes it will compromise the spleen as well, because where it twists, the blood vessels that go to the spleen are in the same place, and so that will also stop blood flow through to the spleen. And it is most often fatal if it's not quickly caught and corrected. So it's interesting, bloat is very common in large breed dogs, but not super common in Otterhounds, which is great news for us. So the question is, what can we do? Oh, so I included this, this link here, and I actually have it. Hang on a minute, guys. I have it pulled up right here. If you learn nothing else tonight, I want you to learn that the website that you want to go to for any medical question is called veterinarypartner.vin.com. Okay, and that is what is included on the slide. This here, what you're seeing now, is veterinarypartner.com. And they have, you can see over here on the left side, there's tons of different things that they talk about. But I thought I pulled up their slide on bloat, the mother of all emergencies, because it really is. And so, sorry about that. There we go. So when we're looking at bloat, here on the right side of your screen, you should see the normal position stomach. And so this is a dog laying on their back. You can see its little hound ears out.
Joey?
Yeah.
We, or at least I cannot see that. I'm still seeing the slides.
Oh, okay. Sorry, guys. Let me get it. I know what I did wrong. Let me fix it. Sorry. No. Hang on a minute. Thank you for letting me know.
Yeah, absolutely.
Okay, so everybody should be seeing it now? Yeah?
Good to go. Yep.
Good to go? Okay, so over here on this side, we have the normal position stomach, and this little doggy here is laying on his back, and so you have the esophagus coming down. They have it actually a little bit more centered than it is. Everything is really over here a little bit, so it's a little bit more to the dog's left. And so it comes down, and this is the stomach, and the stomach comes into the stomach, and then everything exits the stomach right here through the pylorus. And then this goes into the duodenum, which is the start of the small intestine that you can see kind of hanging there. So when the stomach starts to bloat, I'm pretty sure that this is a video when it's not working on my computer. So if you go to this website by itself, you may see this actually turn into a video, and it will develop into a bloat, but they also have the pictures down below. So we're going to just go down on our screen a little bit. So here you see the stomach, food comes in through the esophagus, air, water, fluid, whatever comes in through the esophagus and goes out through the pylorus. So when it starts to distend, it gets bigger. You can see now the stomach is much bigger than it was. And so it changes where the pylorus is, and then everything kind of twists around. So the stomach twists on its axis, and what we have ended up with is that the stomach is pretty much backwards. Now the pylorus is way over here, the esophagus is over here. Everything's been changed, so you can't get something down into the stomach, and you can't get anything out of the stomach. And this black is where the blood supply is starting to die, because everything's been twisted. So this is where it becomes very fatal. So again, veterinarypartner.vin.com is where you are going to find everything that you will want to know in a quality, true information. Because as we all know, not everything on the internet is good information. Okay, back to our slides. I hope.
You're all clear. Continue.
Okay. Thank you. So what can be done to prevent bloat? Well, we don't really know. There have been papers published in the past that have said putting water in the food will prevent bloat. And then there were papers that said putting water in the food causes bloat. And then they said raise the dog food bowls to prevent bloat. And then another study says raising the dog food bowls causes bloat. So pretty much everything that they have tried to prove is the cause of bloat has been shown in some other paper to not really be effective. But the one main thing that we can do is called gastropexy. And basically what that does is if you're in the abdomen of a dog for another reason, or you can go in just to do this as well, you tack the, I'm gonna see if I can easily go back in a minute, because I think it helps to see what it is that we're talking about. So we should be back on our stomach again. And we're gonna just go up a little bit. Hang on a minute. Okay, so here we have our dog that's laying there on their side. This is exactly how they would present at surgery for gastropexy. And so what you end up doing is you cut a little bit of the tissue here on the side of the stomach, and you cut a little bit of tissue on the inside of the ribs, and then we sew those things together. So the stomach is now tacked in position so that it can bloat, it can get bigger, but it can't turn. And so that's a wonderful way to prevent the torsion portion of bloat, which is the really dangerous, life-threatening portion. And so it is recommended for any dogs that have a high incidence of bloat, which again are going to be most of your large breed dogs. I have not seen enough bloat in Otterhounds, frankly, to go in for just to do a gastropexy on them for no other reason. It certainly would never be wrong to do on any large breed dog, but usually I will go ahead and do the gastropexy when I'm spaying an Otterhound. So that means that I don't usually pexy my boys. And I know that there have been boys that have bloated, there have been girls that have bloated. But, you know, again, it can be done at any time. You save a ton of money. You save the health and life of the dog if you do it before they bloat. Any questions on bloat?
I have a question with regard to that, Joey.
Yeah.
What factor does age play in that? You said that it was more common in older dogs. Why is that?
So I think it's more common in older dogs because the ligaments start to break down. I have seen it in younger dogs when they do something stupid like eat 6 pounds of food. A food bloat, once you stretch out the stomach like that, it's going to be more prone to fill up with air and twist again. So if anything, you know, if they do something dumb like eat 6 pounds of food, I'd go ahead and tack them. But I think it's just the loosening of the ligaments as they get older that makes them more at risk for it. We don't really know though. That's just my theory.
And exercise, is that because they're bouncing around? It might flip, or?
So exercise had been shown to be a risk factor, and then it was shown not to make any difference. So I don't worry about my dogs exercising after eating. I don't have dogs that are super crazy. If I had ones that were super, super high drive, high energy, I would probably try to avoid it for a couple of hours after eating. But I just haven't seen it make that much difference. And in my patients that I see that have bloated, I just don't see that exercise is related.
Joey, we have a very good question from Heidi Smith. What are the signs of bloat and how often does it occur in puppies?
So it's very rare in puppies. The signs of bloat are on that website. The most common sign is going to be that they're trying to vomit and nothing's coming out. You will also see their stomach get really hard right behind their rib. So typically the stomach is hanging out closer to the left side of the body. And so you'll see it really hard on the right side, right behind their ribs on the right if they're bloating. But if you have any question at all, this is not something that you want to mess around with and say, you know, I'll wait an hour and see how they do, because that hour could be too long. So if your dog is trying to vomit and not getting anything up, and you see swelling starting on behind their ribs, then I would take them to the emergency room.
Thank you.
Okay. Anything else on bloat?
Nope, that's it.
Okay. But the veterinary partner does go over the signs really, really well. Okay. So seizures, I think a lot of us were there for Dr. Munwana's talk, and I thought she was excellent. So I just wanted to throw in a couple of my experiences with seizures in Otterhounds in particular. And we usually will see 3 different presentations in Otterhounds, which is similar to what she said as well. So the dogs that start seizing under a year of age, unfortunately, it's bad news. It's most common that they don't live past 3. And the reason that they don't live past 3 is because their seizures become uncontrollable. It is most commonly, it's going to be a genetic issue in Otterhounds, but other causes of seizures can happen, which can be liver issues. Those are going to be the most common in a young dog, is that the liver isn't formed properly. And so there's a shunt somewhere, so the liver isn't actually detoxifying the blood. And so that's more common in younger dogs. But if it's an Otterhound and it's under a year, for any dog that has seizures, I immediately will do blood work. If the blood work is normal, then it's not a liver issue. And it's unfortunate that we do see that in our breed. Sometimes they'll start between 1 and 7 years of age. Usually those are manageable. Most often that's also going to be a genetic issue that's called idiopathic epilepsy. Dr. Munwana talked about that as well. And then the other group is over 8 years. And in many other breeds, those are going to be dogs that have a brain tumor. And you see that because it's progressive, they go downhill. If they have the MRI, you can see it. But in Otterhounds, oftentimes we have no cause found for seizures that start over the age of 8. And so we assume that those are going to be genetic as well. So something to talk about is I always, whenever talking about seizures, I think it's important to talk about the seizure threshold. And so every living being has a seizure threshold. And what that means is that there's so much excitation that your brain can take. And once it goes over that, it's going to cause a seizure. And so I think in some dogs, we seem to have a lowered seizure threshold. And I think it's probably a different genetic cause than the dogs that have idiopathic epilepsy. So these are the dogs that will have a seizure because they're going to the vet, or because they're arriving at their breeder's house to be boarded for a period of time, or something stressful happens. And I believe, we don't have any idea yet, but I believe that's going to be a different genetic cause than the dogs that are more typical idiopathic epilepsy. And the most common time for those dogs to have seizures is in the middle of the night. And so those are dogs that will be sound asleep, 3 a.m., they start to have a seizure. So it's really hard when, with our breed, we've had lots of researchers trying to do studies, trying to find the genetic causes of it, but I don't even know that we're comparing apples to apples when we're looking at dogs that have epilepsy, what we're calling epilepsy, and dogs that are having seizures because of stress. So it is something that we're trying to keep an eye on and look into, and trying to compare apples to apples with the studies that are going on right now. And I know there was a question about medications, and Dr. Munwana talked about the oral flea and tick preventatives causing seizures. What's important to know is that the oral flea and tick preventatives do not cause seizures, but you should not use them in dogs that have seizures. And it's the same with acepromazine. So I do not hesitate to use oral flea and tick preventatives in my Otterhounds, but if I have one that has a seizure, I don't use it in them anymore. I'll switch to a different preventative.
I have a question from Anna Schaefer. She wants to know what heartworm or flea or tick meds that you recommend.
So that's a hard one because there's a lot of them out on the market, and your vet is going to have different experiences in their area of the country than I do. So for example, in our area, most of the topicals don't really do much. They don't really prevent fleas or ticks. But the oral flea and tick preventatives work amazingly well. And the Seresto collars also do work well in this area of the country. So again, it may be totally different wherever you guys are. So that's a conversation to have with your individual veterinarian. What I have at my clinic is I have an oral heartworm, flea, and tick preventative that's given once a month. It's called Simparica Trio. That's great. It's once a month. It's one pill that does everything. The other option that we have at our clinic is an injectable heartworm preventative. It's called ProHeart 12. You give them an injection and it lasts for 12 months. And then you don't have to worry about it. It's done. Heartworm disease is managed. And then we go with those dogs, we'll put them on Bravecto, which is an oral flea and tick preventative that you give every 12 weeks. So they have to give that pill 4 times a year. Puppies, I'm using the Simparica Trio on. It's labeled for puppies as young as 8 weeks of age.
I have a question personally, actually, on that injectable and Bravecto. Is that safe in breeding animals?
Yes, Bravecto is the only oral flea and tick preventative that is labeled for breeding animals. And the ProHeart 12 is also labeled for breeding animals.
Awesome. Thank you very much.
Yeah, those work great for breeding animals. I will add that there is some discussion among the theriogenologists, the people that are experts in reproduction, on whether or not the Bravecto label is warranted, because there were birth defects seen in the studies, but they are the same birth defects that are seen in all of their beagle colonies. So we think that they're safe. It's labeled for safety, and I use it in my own dogs, and I recommend it for my patients. But I will add that caveat that the beagle colony that they did the study on is known to have birth defects.
Okay. Is that something that's available nationwide? I have never heard of the ProHeart 12.
It is available nationwide. Not all clinics have chosen to have it, to use it.
Okay.
So before ProHeart 12 came around, ProHeart 6 was around for a long time in the US, and that is an injection that you'd get every 6 months. I was never really a huge fan of it. ProHeart, the injectable form, is the most common thing used in Australia, and it's been in Europe for over 30 years. And so they have a long history of use for it. And I have had no issues with the ProHeart 12. And we've been using it a year and a month now. So I'm putting dogs back in for their second dose.
Is that something that would be safe in a dog that has seizures?
Yes, it is safe in dogs that have seizures. It cannot be given to a dog under 1 year old.
Okay. One other question on the ProHeart 12, I'm sorry I interrupted you, I didn't mean to, is what's the average cost of ProHeart 12?
That's a tough one. We actually, at my clinic, we have priced it to be the same as 12 months of Interceptor Plus, which is what we were using as a heartworm preventative before. So it's really dependent on the clinic.
Great, that's it for that slide.
Okay. Anybody else? Okay. So then there was a question about vaccines. And the most important thing to know is that Otterhounds are not any more susceptible to vaccine reactions than any other dog. So I did want to throw out, though, that there are 2 kinds of vaccines that you'll hear about. And there are core vaccines that are recommended no matter where you are in the US, and it's rabies and distemper parvo. The DAP is distemper virus adenovirus parvovirus. You'll oftentimes also see the DAP listed as DHPP, and that's distemper adenovirus, which is hepatitis virus. It's the same thing. And then parvovirus and parainfluenza. So the non-core vaccines are vaccinations for Lyme disease, leptospirosis, bordetella, influenza, and the rattlesnake vaccine. I went ahead and threw that on there because I think in some areas of the country, the rattlesnake vaccine may be useful for people. There are other vaccines that are out there. You'll see vaccines for coronavirus. You'll see vaccines for Giardia. You'll see vaccines for dental disease. And I didn't include any of those because they really haven't been proven to be useful. But wherever you are in the country, your vaccines should be administered based on your dog's risk of contacting the disease. And that's going to vary by wherever it is that you live. So I think vaccines are a discussion that you need to have with your veterinarian, and know that the viral vaccines, well, particularly rabies, it's a killed vaccine, and then the distemper parvo vaccines, those usually are good for 3 years. They don't require boosters often. And the distemper vaccine, distemper parvo, is one that you can titer for. You can check your dog's blood levels to see if they need to be boosted. I have not yet had an Otterhound who needed to have a distemper parvo vaccine after their 16-week shot. So Odyssey died at almost 14, and she still had great titers after her 16-week shot. So I think that tells you how long it can last in the immune system. For the non-core vaccines, they are not formulated to last as long. They just can't do it. And so you do need to have those yearly, and there's no titers for them.
I'm going to also add that Joey is also going to be giving us a titers webinar on October 22nd. That is not yet on the Groups IO calendar, but that one is on the books. So she'll talk more about titers at that webinar.
If you were in Pennsylvania, you've seen it, but come listen anyway. It's always good information.
It looks like we have a question from Katie Wright. Is lepto considered safe? We've recently heard reports from people that there are reactions to it.
Leptospirosis, the leptospirosis vaccine is considered safe. So about 20 years ago, the lepto vaccine caused more reactions than other vaccines did, but the leptospirosis vaccine has been cleaned up, and over the past 20 years, we see no higher reaction of leptospirosis vaccine than we do to any other vaccines. And we can see reactions to any of the vaccines. A reaction to the vaccine means that the immune system is really fighting it. So, you know, it's something that does happen. But in my opinion, leptospirosis is so much worse of a disease than the risk of the vaccine reaction. So I do recommend vaccinating for lepto in my area. Leptospirosis is a disease that's carried by wild animals and lives in the urine of wild animals. So wherever a wild animal could urinate and your dog may lick their urine, it's carried by fox, deer, squirrels, rabbits, rodents, pretty much everything that's everywhere. And lepto causes liver and kidney failure and can be fatal. So I do recommend vaccinating.
We have another question from Tom Devlin. Even though the vaccine lasts, is it harmful to get the DAP vaccine anyway?
No, it's not harmful to get the vaccine anyway. What you're doing, though, is stimulating the immune system, and that didn't need to happen. So there's potential harm in stimulating the immune system, but it's not because it's the distemper parvo vaccine. It's any vaccine, and any vaccine can do that. So it's an opportunity to not stimulate the immune system if they don't need it.
Cool. Thank you very much.
Yeah. Anybody else? Okay. Anesthesia. I get a lot of questions just from people that have their dogs going under anesthesia, or you know, just random people that are asking me, sending me questions, particularly about their Otterhounds, and say, what is it about Otterhounds and anesthesia? And the answer, again, is nothing special. There's really nothing special about anesthesia in Otterhounds. They are not at any kind of increased risk. But I did want to add that all animals are at increased risk if it's poorly managed anesthesia. And so I wanted to throw out there a little bit of information. You should know that your veterinarian is monitoring your dog's blood pressure, their EKG, their end-tidal CO2, which is the oxygen, the carbon dioxide that they're breathing out, the pulse ox, which measures the oxygen in their blood, and their respiratory rate. And if they're under general anesthesia, then you want to make sure they're getting fluids intravenously. So they're going to have an IV catheter and fluids are going to be going in. And the whole purpose of all of that is to make sure that we're maintaining appropriate blood pressure to support their organs. If their blood pressure drops, then their kidneys suddenly aren't, we're going to end up with kidney damage. You can end up with brain damage. You can end up with a lot of issues. It's not Otterhound specific, it's all dogs. But those are the things that I would always want to make sure are being monitored. I would not leave my dog for a procedure under anesthesia without knowing that the veterinarian is monitoring these things. Any questions about that?
I have a question about that.
Yeah.
Is it uncommon that a vet would not be monitoring those things while they are performing surgery, or is it an issue?
It's an issue.
That's what
Yeah, unfortunately, I think it is. In a lot of the older clinics, the smaller clinics, they may not have the income for the proper monitors. And so they think that they can get away with just doing a blood pressure monitor and not monitoring everything else. But it's really the whole picture that tells you how safe things are going for your animal under anesthesia. And it's really important to be respectful of anesthesia, but you definitely don't want to be afraid of anesthesia. So, people ask all the time, is my dog too old for anesthesia? No, there's no such thing as a dog that's too old for anesthesia. There are things that make anesthesia a higher risk for certain animals. And so those are things that you have to weigh and decide, is the risk of anesthesia worse or lower or higher than the risk of not putting them under anesthesia. The vets that will tell you that your animal's too old for anesthesia are typically not monitoring these things.
We have one more question. What's the difference between twilight and general anesthesia? That's from Anna Schaefer.
Yeah, so twilight is what I call sedation. And so I put dogs under sedation most often for health testing, for OFA, x-rays, for hips and elbows and that sort of thing. I'll also do what you're saying, twilight, or just sedation for small masses, things that aren't going to take a lot of time. They're not very invasive. General anesthesia, they actually are intubated. They have a tube down their throat and they're on a gas inhalant. And so general anesthesia is going to be when they have a gas inhalant.
One question from Joel. How is the airway kept patent?
Under general anesthesia, it's with that tube down their throat. So we put a tracheal tube down for any general procedure. For sedation, it's usually not an issue keeping the airway patent. So if they vomit, it's going to be a bigger issue, and we're always prepared to throw a trach tube down if we need to, and put them on general, but it's not very common that you have issues with that.
Couple questions.
Yeah.
Sorry to interrupt, Carmen.
Good.
So Bev would like to know, is it routine to do blood work before anesthesia? So when they ask you, should we do blood work before, do we say yes, or do we say, well, they just had it done 3 months ago? Or talk to us about that, please.
So I think that you will be hard pressed to find a veterinarian who's willing to do anesthesia without blood work. But the studies actually have shown that for young, healthy animals, it really isn't that necessary. However, I still require it. So you definitely want to do lab work when your dog is young, when they're around a year or so, to have a baseline. You want to see if something's not developing properly, if there's liver or kidney issues that you don't know just from looking at them. So I always want to do blood work when they're about a year old. And then between, say, 2 and 7 for an Otterhound, I would ask for a small panel within 3 months of the procedure, assuming that everything else is healthy. For an older dog, I want a little bit of a larger panel that looks at more things, including electrolytes and other liver enzymes and things, just to make sure that we know that we're going into the procedure with a healthy animal. There's nothing worse than not doing blood work and finding out later that the cat has kidney disease. And you don't know, did you cause it from the anesthesia? Or did the cat have kidney disease going in? And there are things you could have done to prevent it from getting worse. So there's a lot of really good reasons to do blood work ahead of time. But for your young, healthy adults, it's probably not 100% necessary.
What window of time, so if you had a healthy animal that had blood work done 2, 3, 4 months ago, what window of time would you feel safe in not getting blood work before surgery?
So again, that's very case by case. Right now with COVID, we're allowing lab work to have been 3 months ago, where typically we don't let it go more than a month before surgery. So, you know, I think it just kind of depends. If it's a young, healthy, I'll let it go 3 or 4 months. I don't think twice about it. Sometimes I'll do blood work while they're under anesthesia just to have a baseline. So, you know, I don't expect it to change things, but every veterinarian is going to have a different requirement. And so it's really what your vet putting the dog under anesthesia is comfortable with.
Good to know. And then we have a couple questions from Tom with regard to pre-anesthesia. Is there an advantage to having the dog's heart checked as a preventative like we did for TIPS?
Yeah, so any reputable veterinarian should be doing a full exam before they sedate your dog or put them under anesthesia. And so there are some places that you can go where they will just go ahead and pop them with the vaccine and you're off on your way. And those are going to usually be more of the low-cost clinics because they don't have the time to do it all, and you know they're working more on a volume basis. But most of your reputable veterinarians are going to do a full exam beforehand. And so if I find something that's not normal, I won't sedate them, I won't put them under anesthesia until we know what it is and we make sure that it's going to be safe for them.
That's all of the questions on that slide. That's really good information. Thank you.
You're welcome. Okay, the next one was cancers. Everybody wants to talk about cancers. And I would say that the Otterhound is at no higher risk than most dogs and a much lower risk than many breeds. So it's good news for us, I think. The most common cancers that we see are hemangiosarcoma, which is a tumor of the lining of the blood vessels. And you will most often see that as either a splenic tumor or a splenic rupture. You will see it as spots in the liver, or it's also commonly a tumor on the heart itself. Hemangiosarcoma is one of the more common ones and for all dogs, and it oftentimes presents as sudden death because there's no signs leading up to it. It's devastating. And then the next most common one that I hear about in Otterhounds is lymphoma, or you may hear it referred to as lymphosarcoma. It's the same cancer. And that is a cancer of the lymph nodes. And so you have lymph nodes all over your body, and your lymph nodes will make the cells that try to fight things in your body. And so lymphoma will oftentimes show up as swellings. The most common places are going to be the submandibular lymph nodes, so ones that are right under their chin, the prescapular lymph nodes, so they'll be right in front of their arms, and then the popliteal lymph nodes, which are right behind their knees and the back legs. And so if you find swellings there, that's something that I would have checked out right away. Lymphoma can also show up in a GI form. And so they're having diarrhea, they're having vomiting. It's not something that you can really get fixed, and it's just not something. They're losing weight, they're not digesting their food well. And so that's something that we will oftentimes see on ultrasound. And then the other one I threw on there, I don't hear about it very commonly in Otterhounds, but my Odyssey had several of them. My Tony had them, so I figured I'd go ahead and throw it out there, is an adenocarcinoma. And adenocarcinomas are probably going to be the best ones that you can have. It is a malignant tumor, so it can spread. My Tony had one that I removed and sent in, and they said that it looked like it was an adenocarcinoma that had spread from somewhere else, but I never found where it started. So I could never find where his primary adenocarcinoma was. Odyssey ended up with adenocarcinoma in her ovaries. When I spayed her, her ovaries were not normal, and so I sent those in, and she had adenocarcinoma in her ovaries, which could have transferred into other areas in her abdomen. Thankfully, it didn't. She lived for 7 years after she was spayed.
Are there treatments for any of those cancers?
Yes, there are treatments for all of them, depending on when you catch them. So hemangiosarcoma is usually going to be treated if it's a tumor on the spleen. You remove the spleen, and then chemotherapy will cover that. Lymphoma is typical chemotherapy, and adenocarcinoma, depending on where it is and what it is, it could be chemotherapy or it could be radiation that you would want to use to treat that.
One more cancer question. Allie wants you to speak about mast cell cancer.
So mast cell tumors are something that are common in a lot of breeds, but I haven't heard of a bunch of Otterhounds having them. It's not as common, at least in my experience with Otterhounds. And mast cell tumors, the mast cell is a cell that goes in for inflammation. And what it can do then is it goes in and it sets up camp and it just overproduces and it causes a mast cell tumor. Mast cell tumors are difficult because of a couple of factors. You can't judge how aggressive they are until you take it off. So there's 3 grades of there used to be 3 grades of mast cell tumors. There was grade 1, 2, and 3. They have kind of switched their grading now to where grade 2, which is the most common one, is there's a high and a low grade 2. So there's kind of 4 now. Grade 1s generally don't metastasize. Low grade 2s can. High grade 2s are more likely to, and grade 3s usually do metastasize. They can metastasize to anywhere, to internal organs. They can metastasize to other areas on the skin. They can start out in an internal organ. They can start out on the skin. It's more common to see them on the skin than it is anywhere else. And they grow with these finger-like projections. So if you have a mast cell tumor that's small, like that big, my incision for it is going to be, let me back up so you can see, about that big. You can imagine if you have a mast cell tumor this big, our incision is going to be huge because of these finger-like projections. And you always want to go at least one fascial plane, so one type of tissue plane deeper than your tumor is. So it may end up meaning that you end up having to take muscle with it. There's all kinds of things. Mast cell tumors can be really, really ugly. I would say that the majority of mast cell tumors are low grade 2s. So the majority of them aren't bad, but you don't know what they are until after you get it off and send it in. Mast cell tumors are something that should be able to be easily diagnosed. It's something that your vet should be able to look at under the microscope and know immediately that it's a mast cell tumor. They're very obvious.
Allie just said that Murray just had 4 mast cell tumors removed.
That's very unusual.
And then we have...
Allie, do you have the grades back yet?
Allie, feel free to unmute.
Allie. Hit your space bar.
Yes. The grades were low and they were able to get clean margins on all of them.
Okay.
So, but they were, what I'm really concerned about is that, I mean, he's what, 3.5 years old. Is this something that I'm going to have to worry about? You know?
Yes.
Okay.
Yeah, unfortunately it is. I would probably talk to an oncologist.
Okay.
Just to see if they think that chemotherapy now would make a difference for him or not. It's really unusual, like I said, I haven't heard of Otterhounds getting mast cell tumors on a regular basis, but when you have a dog that has multiple ones like that, that makes me think about their immune system more than anything. So
right.
I definitely would do a consult with an oncologist.
Okay, thank you.
You're welcome. Sorry about that. Glad they're off, and glad they were low grade.
Yes.
Here's another question from Jennifer. Is there any indication of causes for any of these tumors?
Interestingly, they're starting to show that hemangiosarcoma may be related to babesia, which is a tick-borne disease. They haven't been able to prove it in all cases, but they have seen evidence of babesia in multiple tumors. So that's the interesting one that's coming along. The other causes are just life, you know, unfortunately. I definitely think that we have to be cautious and aware if we're seeing similar tumors in the same lines. I think that that's something that we need, as breeders, we need to be aware of and paying attention to. Unfortunately, you know, hemangiosarcoma is typically, and lymphoma too. And in our Otterhounds, we're usually seeing them later in life, which is great for our dogs and great for us. But oftentimes they've already been bred or had litters. And so I think it's something that we just have to keep an eye on, recurrence within lines.
One more question on cancers. On the cancers that you listed, if they're caught early and treated, what is the average life expectancy after?
That depends on a lot of different factors. Hemangiosarcoma, depending on how aggressively you treat it and when you catch it, you may get usually 3 to 6 months. Lymphoma, I think the average is 2 to 3 years. And adenocarcinomas, again, depends on where they are and what they're doing. Mast cell tumors, I think that the last I heard, the low grades are like over 800 days, which is going to be, you know, several years, but that's average. That means that there's some dogs that go much longer and some dogs that are shorter. But it really just kind of depends on a whole bunch of different factors.
Jennifer also commented that her Spinoni, who had babesia, died of hemangiosarcoma, and she did not know that. So thank you for that information.
Yeah, that just actually was the first time I heard that was at the Parent Club Health Conference a year ago. It's a conference that the AKC and Purina put on for Parent Club members, or for health committee members from the Parent Club. And it's all being studied right now. At that particular conference, they bring researchers in and they talk about their current studies, what they're doing currently. And so it's before papers are published or anything else. And I haven't seen anything come out yet about the babesia and the hemangio, but it is something that's being looked into. Okay, so what about our Otterhound lumps? Everybody knows Otterhounds get lumps. So my recommendation is to check every one. Particularly, you know, you think about a case like Allie's little Murray. He's a young guy. You wouldn't expect him to have 4 mast cell tumors, but you don't know unless you check it. And so to check it, what I do is I stick a needle into the lump, and then I put the needle on a slide, or the contents of the needle onto a slide, and I look at it under the microscope. If I can tell what it is, then great. And if I can't, I'll offer to send it to the pathologist and have them look. If it's something that looks benign, I can usually tell you it looks benign or it looks like it may be malignant. Your veterinarian's comfort with reading slides is very variable. And so there are some veterinarians, even in my office, where they send everything to the pathologist, and other veterinarians who don't really send anything. So you really have to be comfortable with how comfortable your vet is on checking them. But if it's something that grows quickly, bothers the dog, or opens up, I would just go ahead and have it removed. Otterhounds usually will just grow more, and there's usually no reason to remove them all unless it's not your average Otterhound lump. The majority of Otterhound lumps are trichoepitheliomas when you send them for pathology, which is a benign growth of the hair follicle. I think that's all I have on cancers.
No more
Anybody
questions on that.
have any other questions on that? The other question I get asked a lot is, should we send it in? And I can tell you that my general response is if it's worth taking off, it's worth sending in. So if you're gonna spend the money to have it removed, you might as well find out what it is and make sure that you've got clean margins on it. Having said that, I just took one off of my own tees and I didn't send it in because I was confident with what it was. So if I have multiple growths that I take off at the same time, I'll usually try to look at them, and if they look similarly, I'll send one in. If they look like there's 2 or 3 different types, I'll send in a sample from each kind rather than sending in all the masses, because that can really become cost prohibitive. And then the last question that we had was on cataracts and microchips. And so I believe the question was if cataracts were common. They are not common in Otterhounds. I have not heard of Otterhounds getting cataracts, but lenticular sclerosis is. And so the main difference between cataracts and lenticular sclerosis, if you look into a dog's eye and it looks cloudy, you may think that they have a cataract, but it's more likely to be lenticular sclerosis. So as dogs age, all dogs, not just Otterhounds, the lens in their eye, it's normally a fluid-filled packet, and it becomes hard. And so as they age and the lens becomes hard, it starts to look cloudy looking out. The difference is that when I'm doing an eye exam, I can see through that lens and see their retina. With a cataract, it actually covers the retina. So there's portions or the whole retina that I can't see. And if I can't see the retina, then they can't see out. With lenticular sclerosis, their vision is decreased. I tell my clients that it's like they're looking through a frosted pane of glass. And so their vision is not as good in low light. So as my dogs get older, I always make sure I'm turning lights on for them when they're doing stairs or in another situation. If I know that there's a bunch of dogs laying around the room, I'm going to turn a light on if my old dog comes in so she doesn't step on somebody, accidentally. And then the other one was about microchips and microchip migration. And microchip migration is something that does happen. In this case, I believe the puppy was microchipped at a young age, and then the chip started to migrate down a leg. And it's not unusual. It's not going to cause any kind of problems. The only problem with it is that somebody's going to, if that puppy gets lost, somebody's going to check it for a microchip back between the shoulder blades where they usually are, and it won't be there. And so as the dog matures, you may benefit from having them put a second microchip in between the shoulder blades so that the microchip is where people would expect to find it. But I know when we have stray dogs come into the clinic, we're checking them from toe, head, all the way back through their tail. So I think most clinics will check everywhere for a microchip, but it is something that would be more likely to be missed. Your vet should always be checking your dog's microchip at least once a year. And it does happen where microchips just stop reading. You can still see them there on x-ray, but they just don't read anymore. And depending on the company that provided the microchip, Home Again is the company I use, they'll provide you with a new microchip for free. And then the registration, they keep both numbers on file so that if for some reason the old one is read, it'll still get back to you. So you do want to always make sure your microchip is working. And if your vet can't find it because it traveled too far away, then chances are good that nobody else will find it either.
One more question, back a slide on the cancer. Lumps versus scabs. How big is a lump?
So scabs are usually going to be things on the skin that there's nothing really underneath it. A lump is usually not going to start out as something that's ulcerated where they have a hole in it. And so the lumps, the Otterhound lumps, are usually going to be the things that start up, a little firm growths that start out under the skin, and then they may grow some. But a scab is usually going to be actually a scab. Did that answer whoever question that was?
I forgot which person asked it. I'm sorry, person. It was
Let's see.
I do have one more question from Joel. Joel asks, is there a way to prevent frequent UTIs as a bitch is going into season or while she is in season?
Yes and no. Keeping the area clean and dry is the best way to prevent UTIs at any point. And so you may want to take a baby wipe and wipe her after she goes potty. That's going to be probably the best way to prevent them. There are other options for prevention depending on what kind of UTI they get. And so you would need to culture it and see what the bug is before you can decide if any of the supplements that are out there are going to be useful.
I have a couple more questions from Joellen Render. Joanne would like to know what level of change in behavior during hot, humid weather is normal for a 1-year-old. Should they be eating much less, unable to complete a half-mile walk, or sleeping excessively?
I think that really depends on the dog and the environment that they're in. It's very dog specific. If you're worried, I would take your dog to the vet for blood work and make sure everything seems okay. I definitely do see, you know, and if it's been winter and the first warm day we have in spring, it's really common for dogs to have heat exhaustion and not have the stamina that they do at the end of summer. So depending on when it is that it happens, if they've had some cool days and then all of a sudden it's really hot and humid, I would say if you're having trouble breathing, then the dogs probably are too.
Another question from Joanne is, what can help separation anxiety, especially when one of us leaves in a car? Do calming sprays, foods, or supplements work?
Sometimes. So it's usually where I start are the supplements, and the Adaptil collar is a great option. It's a collar that goes on. It's a pheromone collar. You can buy them at most pet stores or online. That can work. There's a new product, new-ish product on the market from Purina called Calming Care, and it is basically bacteria that produce calming signals in the brain. It's not a probiotic, even though it's not a probiotic in the gut, even though it technically is a probiotic. But it works great for some dogs. I do all of the veterinary work for a service dog group, and we had one dog that couldn't fly anymore. We put him on Calming Care, and he flies with no problems now. So it's very specific, though, to individuals. So there are some dogs that do great on it, and it doesn't really seem to affect others at all. I think that the most important thing is to keep in mind that desensitization is the most important part, and you can use medications to help, but without behavioral desensitization, medications are never going to do the job by themselves. So you really have to work with the dog to get used to, you know, so leave them home and close the door and come back in. Leave them home, walk to the car, come back in. Leave them home, drive to the end of the driveway, come back in. So it's going to be, you know, slow desensitization until they don't really seem to mind that you're going and they know that you're coming back.
On that same topic, do you recommend any probiotics? I've heard they can be wonderful for the guy and our gut and immune system.
Yes, I love probiotics. Probiotics are, you know, your gut is your biggest immune system in your body. And I think probiotics are good for everybody. There are 3 probiotics that are on the market that have been studied. So 3 of them out of all of the various probiotic options that are out there are there have been 3 that have been shown to have what they claim to have in them and to do what they claim to do. So the 3 that are out there are Fortiflora by Purina, Proviable by Nutramax, and then Visbiome by Visbiome. So Visbiome is my favorite for acute things because it also has some anti-inflammatory properties to it. It's amazing. Proviable is what I use on a daily basis because I think that probiotics are good for everybody.
Are those prescription items or over-the-counter items?
Proviable is over the counter. I have not looked lately for Fortiflora, and Visbiome is only available for through veterinarians. Yeah, I haven't looked for Fortiflora lately. I don't know.
I saw that as of last September. That was just able to buy from Purina.
Okay.
A couple more questions. Oh, also on that same topic from Katie. When I looked at Fortiflora, it said for dogs with diarrhea. Can it be used all the time?
Absolutely, yeah. Fortiflora has the fewest number of bacteria in it of the 3, and it also has only one kind of bacteria, where Proviable has 7 different types of bacteria. So if you're doing it as a preventative or just a prophylactic just to help, I prefer the Proviable just because it has more bacteria, but there's nothing wrong with the Fortiflora and you can use it regularly.
And Tom says he can get it from Amazon.
Okay.
So,
I think Tom uses the Proviable though. I don't know if he's tried to get
I'm sorry,
Fortiflora.
Tom, when you're talking about he just said I get it at Amazon.
Yeah, I know he uses the Proviable.
Tom, unless he says different, gets the Yep, it's the Proviable he gets from Amazon. Thank you for clarifying that, Tom. Couple more questions with regard to that. From Tracy, are there food/nutrient breakdowns for adult dogs similar to what you gave us for the puppies?
Again, my most important thing is going to be that it was food trial tested for adult dogs. It can be for all life stages, or it can be for maintenance of adult dogs. So I have no particular need for calcium phosphorus ratios in adult dogs, because that's only important as the puppies are growing. That's what keeps their bone growth at a rate that their bodies can keep up with it.
Good to know. From Mark Williams, how about warts in dogs? I remember researching warts a few years ago, and I encountered conflicting information at every step. For example, whether warts were indicative of a larger issue or were simply sources of discomfort. I also found sources that said warts were highly contagious and others that said they were not at all contagious, perhaps based on the age of the dog? ?
So I think that that's a hard one, because the term wart can be used for a lot of different things. And I use the term wart when I'm describing adenomas, which are a little warty type growth. And so they look like little warty things. They're just little things on the skin. They don't usually grow into anything. They don't do anything. And, they're benign growth. So those kinds of warts are not important. If a dog decides that they're going to really chew at one, then I may end up removing one because it's bothering the dog, but it's not typical that they do. The other thing that people will use as wart is for papillomavirus. And papillomavirus is extremely contagious. It's much more common in young dogs, and it shows up as a white cauliflower-like growth, typically around the mouth, but papillomaviruses can be anywhere. And so papillomavirus is just the immune system is not able to get rid of it, and it just takes time. Most dogs will work through papillomavirus. Sometimes I'll give them a supplement for immune support while their bodies do that. I've seen papillomaviruses that cover the whole inside of a dog's mouth. And, those dogs are having a hard time eating. You want to make sure that you're feeding them so they can eat, because it's painful. But most often papillomaviruses, you're just going to see a couple of growths here and there.
Here's a question from Kim. For Otterhound lab work, is it normal to see a slightly high monocyte level on the CBC? Our 1-year-old labs reflected that, and our breeder mentioned his mother has also had that on her CBCs.
I would say no, it's not typical for an Otterhound, but it's not unusual for high monocyte levels, particularly if the dog has had water withheld. So dehydration can sometimes affect that as well. So if it's just mildly elevated, I wouldn't be too concerned about it.
Good to know. Here's a question from Robin Burmeister. This might be it depends answer. How much food per day for young dogs and as adult dogs? I think that kind of goes along with your feeling the ribs every day.
Exactly. So you feed them to their proper body condition. And so it's going to be different for everybody. You know, I have a friend who's my height and she weighs a third of what I do, and she eats 3 times more. It's really just all based on their body condition and their metabolism. And so you feed them to their proper body condition.
And for Robin, if you joined us late, I think I remember maybe admitting you a little bit later on. If you joined us late, you're going to want to go to the YouTube video of this OtterTalk and watch watch Joey's description of how you feel the ribs.
Hand. The
Yep.
hand knows it all.
Yep. She went through that, and it was really helpful information. Instead of like a score index and stuff like that, she showed us on her hand and fingers and knuckles. So, oh, she did see that. Perfect. So where's your answer? Feel the dog, and if they need to eat more, feed them more. If they need to eat less, cut them back a little bit. I think that is all. Carmen, did you see any questions on the chat that I might have missed? And if anybody has any other questions, now's your time to throw that in the chat.
No, as far as I can tell, we hit everybody. I do have one question that was pre-sent in to us from Jody and Steve Persky. Their question was, what is the criteria for breeding and what is looked for in the dogs specifically?
So that's a tough one to answer because I think it is breeder specific. And so I think that each breeder will have different criteria for what they're looking for in a dog. Personally, as a breeder, I want to know what the results are of their health tests. You'll notice the way I phrase that is very different from I want them to pass all their health tests. I want to know what the results are. I want to know that their dog has strengths where my bitch needs it. So you have to be able to very critically look at your own stock and decide where you need to improve on what it is that you're breeding. And so you're looking for a dog that is correct in those. And so it may be that as a breeder, I think a dog is very useful for my breeding program, and maybe Carmen, he's not useful at all to you. And so that's perfect, actually. That's ideal for the Otterhound world if we're using as many different dogs as we can, because that is what will keep our genetic diversity.
Thank you.
So if there's any other questions, you can either put them in the chat or you can open your mic up and ask questions. While you're mulling that over, I want to, first of all, thank you, Joey. That was fantastic. I am so glad that we did this one. This is one of those that started out as a house party where everybody at the house party said, yeah, and what about this, and what about this, and what about this, as I was frantically jotting down all of those things. So, but it was fantastic. I'm really excited how well it went. And again, it'll be on the YouTube Otterhound Club of America channel for referring back to, and feel free to share it with anybody. As all of the OtterTalks, if you ever see an OtterTalk that you think somebody else is interested in, everybody's welcome. It's not just restricted to members. And Joey is going to be doing a tighter webinar for us on October 22nd. I mentioned that earlier, but some of you joined us a little bit later. Other OtterTalks we have coming up is a nose work and scent detection on October 14th. And a tracking seminar with Eileen on September 29th. And I think that's all that we have scheduled. We have some really cool ones also on the horizon that are scheduled, but we don't have specific dates yet. We have a form and function one coming up, and a grooming and maintenance one coming up. We've got a walk down memory lane one coming up. We've got the use of CBD in maintenance and control of seizures one with the University of Colorado or Colorado State University. I don't know which.
Colorado State.
Thank you. That's in the works. So a lot of things coming up in the OtterTalks. And also, if any of you have knowledge on certain topics and you'd like to be a guest panelist, please let us know. That's the only way we find out is by somebody saying, hey, I know how to trim toenails really well, or I don't know what you know until you tell me. So please volunteer for anything that you might have helpful knowledge about. So any other questions, feel free to unmute yourself and ask.
I just wanted to add that I will have my PowerPoint that I used tonight available. I don't know if you can put it with the YouTube, Robin.
I can sure try, or we can
Or we
figure
can just put it
somewhere.
in groups.io.
You
But
know,
we'll
it's
have that.
fantastic.
Yeah,
The
we'll
other-
have that available for anybody that wants to review back, particularly for the veterinary partner.
Yeah,
The
that's,
most important thing.
yeah.
But I also wanted to add thank you to Robin and Carmen for doing all of these. I know I've been involved with several of them, and it's been, you know, it's time consuming for us, but it's certainly time consuming for you guys. And I just want to say how much I appreciate that you guys are doing it all.
And you know, I really, 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 really appreciate all of your help. You've become my go-to gal for stuff. And I've only been in the club for a very short while. I'm on my very first Otterhound, and I breed a different breed. So I'm not the one that knows in the club who knows what and who's an expert at this and who's an expert at that. So I apologize if I've overworked you, but it's because
not at all. But you guys
people we know are like, here I am again.
Well, and we enjoy every second of it, and every smiling faces whenever they pop up on the Zoom. So thank you all for coming as well.
Absolutely. One other note, I want to let people know that if they missed Dr. Muana's epilepsy seminar, it's available on the Otterhound University, and that there's a link to that on the otterhound.org website. And I think I might, in the YouTube description, when I post the YouTube, I think I'm going to list a couple of those things that we had, like the anesthesia thing and the website that you gave us for veterinary partner.bin. I'm going to have that right on the YouTube thing, so it's easy for people. Anybody else have any questions? Everybody's saying it's greatly appreciated, and Aruz, and great job, Joey. Thank you so much. Thank you so much. Thank you so much. Awesome information. One other comment.
No, Katie, they don't.
Do you feel any?
No.
Do you feel any of the stop poop eating tablets work?
No.
No.
Picking it up. That's all it works.
Yeah.
Now, what do you think about pineapples and cabbage? Because I've heard rumors that might work, but
I tried it. Didn't work for me. I've tried everything. The only thing I have found that works is getting it before they do. My Muddy, I don't know if many of you guys remember Muddy. He would stand behind Tony like he was an ice cream dispenser. And it was impossible to even get it before he did. I'd have to chase them away from Tony while Tony was pooping. But picking it up before they do, that's really the only thing that works.
When we got our Ellie, she used our Black Russians as dispensers too. Yeah. So that was the only thing that worked for her, is just getting out there and literally like getting it on the poop scoop before she could get there.
Yep, exactly.
Yeah. Just grab the scoop mid-rounds, making you don't miss anything.
You know, cleaning it up before they get to it really does work. So that's what I recommend.
It does. It's a
chronic poop eater.
What, Katie?
I said Penny is a chronic poop eater, and I can say some of her puppies have followed suit.
Yay, you!
Yeah, I literally chase after them before anyone else can get it.
Many of my girls will turn it into a game. They make sure I see them get it going for it. And then as soon as I'm within about 5 feet, they grab it and toss it back and swallow it.
And some of them get really smart about it too, because they pretend that they don't see anything. And then when you try and go get the shovel, it's like, oh crap, you know, literally.
Yeah, crap.
I think one of my Black Russians took a page out of Ellie's book, because if I try to get weight off of her, she goes and she will munch down a poop while you're